Radical cystectomy, Indiana pouch continent urinary reservoir. What is a radical cystectomy? This is the surgical removal of the bladder. In men, the prostate gland is also removed. In women, the uterus is also removed. What is the normal urinary tract? The urinary tract is made up of 2 kidneys, 2 ureters, a bladder, and a urethra. The kidneys are towards your back at waist level. The kidneys filter blood and make urine. Each kidney has a ureter or tube that carries urine into the bladder. The bladder stores urine, then it is passed from your body through the urethra. Indiana pouch. The Indiana pouch is a continent urine reservoir made from part of your bowel to store urine. The end of the pouch is then brought out through an opening in the abdominal wall and a stoma is created. You will drain urine from the pouch many times per day using a catheter. Surgery will not affect how you have bowel movements. This pouch is connected to the skin by a small stoma that is drained by inserting a thin tube called a catheter into the stoma. After the pouch is emptied, the catheter is removed. What is a stoma? A stoma is an opening that connects the Indiana pouch to the outside of your abdomen. There is no feeling in your stoma. After surgery, your stoma will be swollen, but it will shrink during the first 2 months. The stitches around the stoma will fall out by themselves. Keep the skin around your stoma healthy. Getting ready for surgery. Your preoperative exam will consist of a physical exam, laboratory tests, a chest x-ray, and EKG. There may be additional tests per the surgeon's discretion, such as a venous duplex ultrasound. The purpose of this ultrasound is to look for any blood clots in the legs. You should get yourself as healthy as possible before surgery. Maintain your exercise plan. If you don't normally exercise, it is a good time to start walking. Eat a healthy diet that is full of protein to help with wound health postoperatively. You will also have teaching done with the urology nurses to help you get ready and provide any instructions prior to your upcoming surgery. 1 week before surgery, you will need to stop taking over-the-counter pain relievers such as aspirin, ibuprofen, Advil, Aleve, naproxen, or prescription nonsteroidal anti-inflammatories. Tylenol is acceptable to take as needed for pain. Also stop taking any non-prescription vitamins and herbal supplements. These may thin your blood and put you at high risk for bleeding during surgery. We will work with you and your provider about specific instructions for stopping other blood thinning medications that have been prescribed by your provider, such as warfarin, Plavix, Eliquis, or Xarelto. The day before surgery. During your preoperative teach, you will be instructed how to prepare your bowels for surgery. The goal is to get the bowel cleaned as much as possible when we create your new bladder. Before going to bed the night before surgery, shower with HIPAA-cleansed soap. Do not wash your face or genital area with this. Take another shower using the HIPAA-cleansed soap before leaving for the hospital in the morning. Do not apply any products to the body, such as lotions or deodorants. The day of surgery. The day of surgery, you will check into first day surgery in the hospital. First day surgery is located up the D elevator on the 3rd floor. Turn left off the elevator to first day surgery. Pack loose, comfortable clothes. You should bring your current medication list with you. You should also bring any inhalers, CPAP or BiPAP machine if you use one, or glucometer if you have those. Leave any valuables at home. After surgery, You will be assigned a hospital room. You should leave your belongings in the car until you reach your hospital room. Incisions, drains, tubes. There is an incision along your abdomen. Your incision is held together with small staples. They allow the skin to heal with the least amount of scarring. There may be drainage from the incision. The incision will be cleaned and the dressing changed every day. Your staples will be removed at your first post-operative clinic visit. The stoma tube goes through your stoma and into your Indiana pouch. It drains urine from the pouch to an ostomy bag. It is taken out at the second follow-up visit. If the tube falls out, this is okay. A suprapubic tube is a tube that goes into your Indiana pouch through the skin below your stoma. It connects to a drainage bag. It drains urine from the pouch while the pouch is healing. It is flushed to prevent a mucus plug. You will go home with this tube. It is taken out at the first follow-up visit. You will have a leg bag during the day and a larger bag at night to hold urine. Stents are two small tubes placed through the stoma into your pouch and up the ureters into your kidneys. These stents drain the urine while the pouch is healing. They drain into the same ostomy bag as the stoma tube. You will go home with the stents in place. They are taken out at your first follow-up visit. Call the urology clinic if these fall out. Jackson Pratt, or JP drain, is a soft rubber drain that is near the incision and comes out through the skin. It drains fluids from around your Indiana pouch. A Foley catheter is a tube placed in your urethra to drain fluid from the space where your bladder was located. A nasogastric, or NG tube, is in your nose that goes into your stomach. It drains your stomach to help your bowel rest as it heals. The NG tube is placed while you are in surgery and stays in for about 3 to 5 days. The NG tube will be removed once you begin to pass gas. Your hospital stay. This is a major abdominal surgery, so you should expect to stay in the hospital for 7 to 10 days. The day after your surgery, you are expected to get out of bed and walk. Moving and walking are the best way to speed your recovery. This helps to prevent pneumonia, blood clots, and gets your bowels moving after surgery. Use your pain medication to keep your pain at a mild level so that you are able to get up and move around. Home care. You and your primary support person will be taught how to care for your stoma, pouch, and tubes while at home. Wash your incision gently with soap and water every day and pat dry. Stoma care. You may wipe off mucus buildup with plain warm water once every day if needed. Please be cautious of your sutures. Your stoma may bleed when cleaned. This is normal. Once healed, stomas may be uncovered during a shower or bath. You should never scrub and only pat gently with a soft towel to dry. Later, when you are healed and the tubes are out, you can cover the stoma with a small gauze dressing. Go to the nearest emergency room if your stoma turns a dark color, if your stoma looks dusky blue, gray, brown, or black, or if bleeding does not stop. Suprapubic tube care. Clean around the tube every day with mild soap and water. A dressing is not needed unless there is drainage around the tube. Flushing your tube is important, as mucus in the urine is normal since the pouch is made from part of your bowel. Flush up to 2 to 3 times every day to prevent plugging with mucus. The supplies you need are an irrigation set, and saline. Write the date you open the saline bottle. Steps. 1. Wash your hands with soap and water for at least 15 seconds. Rinse and dry your hands with a clean towel. 2. Stand by the sink or sit by the toilet. 3. Fill the irrigation bottle with 150 to 200 ml of saline. 4. Draw up 40 to 60 ml of saline into the syringe. 5. Gently flush saline into the SP tube. Gently withdraw fluid or allow it to drain freely. Repeat these steps 3 to 4 times until the urine is mostly clear of mucus. Do not flush more than 4 times. This could overfill your pouch. Connect the suprapubic tube to the leg or night bag. Wash all items in warm soapy water, rinse well, and air dry on a clean towel. Drainage bags. Your suprapubic tube will drain into a leg bag during the day. At night, you may want to use a larger bag or a night bag. Both bags attach at the same point. Empty your bag when it is nearly full. Be sure to close the bag when you are done emptying it. Indiana pouch care. At your second clinic visit, we will perform a pouchogram to check the healing of the pouch. Antibiotics will be prescribed before this visit. There is no preparation for the test. The test is not painful. A dye will be put into the pouch through the suprapubic tube and x-rays are taken. If there is no leakage, we will teach you how to catheterize your pouch. It is helpful to have a close family member or friend present so they can also learn this skill. Even though you are catheterizing your pouch, your suprapubic tube will remain in place. The suprapubic tube will be clamped. It is left in place as an alternate way to drain the urine from the pouch in case you have problems with the catheter. It is important not to let the pouch get too full. Catheterization might be difficult when your pouch is full. At your third clinic visit, the suprapubic tube will be removed. This is not painful. A dry gauze will be placed over the site. Change the gauze every day or as needed until the site is healed. The site may leak urine for a few days. You will need to empty your pouch on a schedule. At first, the pouch only holds a small amount of urine. Over time, your pouch will mature and increase in size that by the 4th to 5th week after the SP tube is out, your pouch will be large enough to hold enough urine to wait 4 to 6 hours between catheterizations. How often to catheterize? The first week, catheterize every 2 hours during the day. Connect the suprapubic tube to the large bag at night. Week 2, catheterize every 2 to 3 hours during the day and once every night. Set an alarm clock at night. Week 3 and on, begin to increase the time between catheterizations to every 3 to 4 hours. In time, you will have a routine. It is best to catheterize when you get up in the morning, just before going to bed at night, and every 3 to 4 hours in between. Always catheterize before you go to sleep. This will avoid the need to wake up during the night. Feeling full. A feeling of fullness or cramping can be felt when your pouch is stretched. This means you need to catheterize. Remember that the fluid you take in affects the amount of urine you put out and the number of times that you will need to catheterize. If you drink a lot of fluid, you may need to catheterize more times than usual. It is not harmful to catheterize every 1 to 2 hours if needed. Avoid waiting longer than 4 hours before you empty the pouch. When to flush the Indiana pouch. Flush the Indiana pouch every day and as needed to clear out mucus. Typically in the morning after the urine is drained. Flush saline through the same catheter that you drain the urine through. Use the same steps that you use to flush the suprapubic tube, but instead you are flushing your pouch. Signs of infection. You should report these symptoms to your doctor or the urology clinic. Chills, temperature greater than 100.4 by mouth for 2 readings taken 4 hours apart. Bloody urine, foul smelling urine, flank pain, pouch leakage, loss of appetite, nausea, or vomiting. Diet after surgery. Follow a soft general diet until your next follow-up visit. Some foods may change the odor of your urine. Examples include eggs, fish, asparagus, spicy foods, and vitamins. You will find different foods that may change the odor as well. Drink at least 8 to 12 8-ounce glasses of liquids every day. This is very important to stay hydrated. If you do not stay hydrated, increased mucus can form in your pouch. Activity after surgery. Return to your normal routine as you are able. Walk around the house every day to decrease the chance of pneumonia or blood clots after surgery. Do not do anything more strenuous than walking until your doctor says that it is okay. Do not lift more than 10 pounds for 6 weeks after your surgery. You may shower when all tubes and drains are removed. Do not soak in a bath, hot tub, or go swimming until your incision has healed. Check with your doctor. You will need to seal the stoma with a dressing and special tape or a special cap. Do not drive for 4 weeks or while taking narcotic pain pills. No contact sports such as football, basketball, or racquetball until it is okay with your doctor. Always empty your pouch before any activity in which trauma to the pouch area could occur. You may resume sexual activity when you are ready. Some people worry about being accepted by their partner. Talk about your feelings. Your loved one may be afraid of physically hurting you. You need to let them know that having sex will not harm the stoma. After 2 months, most people can return to the things that they enjoyed before surgery. Travel. Travel as much as you like. Always bring all of your supplies with you. Keep extra catheters at work. And when flying, carry all of your catheter supplies in a carry-on in the event that your luggage is lost. Troubleshooting problems. Leaking. When the pouch is new, it may leak. This is normal. If there is a fair amount of leakage, a pouch can be worn over the stoma as needed. Clinic or ostomy nurses can help you. Leaking may mean that you need to catheterize more often, or because your pouch is not big enough to hold the urine you make. Increased frequency. There may be times when you have been on a routine schedule for days or weeks, and then you find that you have to catheterize more often. This is common. This may mean the pouch is healing, or you could have a mild infection. Problems passing the catheter. The stoma will have some swelling. This is normal. It may take more time to empty. Change your position from sitting to standing or lying down. This may help. Try not to look down as you insert the catheter. This tends to tighten your muscles and it can make it more difficult for the urine to empty. You can locate the stoma opening with the catheter tip and then stand straight. If you cannot pass the catheter after 1 hour, or if you have severe pain, go to the emergency room or urgent care. Bloody urine. Flecks of blood in the urine or on the stoma are normal. If your urine is pink or red, you may have an infection. Please call the urology clinic. Unable to fully empty pouch. This is normal. It takes time, practice, and patience to know when the pouch is fully empty. Your position, whether it's standing or sitting, can affect this. Find a position that works for you. Use gentle pressure with your hands on your abdomen to help drain the pouch. If the pouch is not fully drained, it fills up faster. When the pouch is new, it is very important to catheterize on schedule. Med-alert identification. It is recommended that you carry a medical identification with you at all times. Keep a card with information about surgery that says continent reservoir with you at all times. You should wear a medical alert bracelet or necklace with the following information engraved. Continent urinary diversion. Stoma must be catheterized every 3 to 4 hours with a catheter. You can obtain the forms for Medical Alert ID from a pharmacy, or you can find them on the web at www.medicalert.org or phone 888-633-4298. When to call the doctor. Call the doctor if you have low or no urine output. Increased urine leakage between catheterizations, if you are unable to insert the catheter, if your urine is thick, cloudy, or foul-smelling, blood in the urine, chills, a temperature that is greater than 100.4 for two readings that have been taken 4 hours apart, nausea and vomiting, abdominal or flank pain, and pain you cannot control with your pain medication.